Hi, my name is Krista Marshall. Thanks for taking the time to visit my website and learn more about my practice. I want to give you just a little bit of information about me so that you can make an informed choice about whether or not I might be a good therapeutic fit for you. I'm a clinical psychologist specializing in working with people who are having trouble adjusting to change or who are dealing with depression, anxiety, or trauma. I work with people over 18 years old, and I see individuals, couples, and groups. My goal is always to help clients identify obstacles to living their best life and use my knowledge of psychology to help them come up with a plan to meet goals in a way that feels safe, supportive, and empowering. I also believe in integrating evidence-based practices into my work to make sure that the interventions that I use with clients are backed by research and help produce change. If you'd like to read more about some of the types of treatments I use with clients, take a look at the Evidence-Based Psychotherapies tab on my website, which is kristamarshall.com. In addition to the therapy services I provide, I also conduct psychological and neuropsychological testing to help people clarify their mental health and brain functioning and provide comprehensive treatment recommendations. During my training, I developed expertise in traumatic brain injury, recovery after major illnesses like cancer, life after surgery, and behavioral approaches to manage chronic pain. I also have a special interest in working with new mothers and their partners during pregnancy and after birth and adjusting to parenthood. This includes helping individuals and couples who are having fertility issues, suffered miscarriages, or lost a child due to a life-limiting illness during gestation or after birth. In addition to working with new moms, I love working with veterans and their families. I did a significant amount of my training within the Department of Veterans Affairs and then worked as a staff psychologist at the McGuire VA here in Richmond for 3 years before starting my private practice. I always welcome opportunities to continue working with vets and families in my current practice. Clients come to see me for lots of issues beyond the ones I just mentioned. I have a list of common problems someone might be experiencing when they decide to start treatment with me on my website. You can also look there to find out more about my education and training. I want to take a moment to introduce my practice manager, Renee Grinnell, so that she can explain how the intake process works. Whoop!
Hello, I'm Renee. We know for a lot of people making the first phone call looking for services can be stressful, so we want to take a moment to explain how that process works. When you call us to make an appointment, you will be reaching Dr. Marshall or me directly. She and I handle all of the scheduling and insurance billing ourselves. Many clients tell us they appreciate the personal approach of our small practice. Let's talk about making that first phone call. We want to take some of the mystery out of that for you. When you call to make your initial appointment, the first thing we'll do is talk with you for a few minutes to get a quick sense of what's bringing you in for treatment and to assess whether or not Dr. Marshall's skills might fit your needs. If we don't think she's the right provider for you, we'll talk with you about ways to locate a good therapist and may even have some specific referrals for you. If it seems like she would be a good fit, we'll take down your demographic information. Then we'll find a time that works for an initial appointment and talk about intake paperwork to complete before your first session. There are 3 options for filling out initial paperwork. The paperwork can be sent to you online via an encrypted, HIPAA-compliant patient portal. You can also download that initial paperwork from the practice website, print it out, fill it out, and bring it with you. Or if you don't have access to a printer, we can leave a copy for you in the waiting room to complete before your session starts.
A lot of people have questions about the affordability of counseling, and I believe that everyone should have access to quality, affordable mental health care. And as a result, I'm already paneled with a number of insurance plans. I'm also in the process of becoming paneled with additional insurance plans. So if you'd like to know whether or not I accept your insurance, check the Rates and Insurance tab on my website for an up-to-date list of the insurance plans I'm currently accepting. If I'm not currently enrolled with your plan, you may have out-of-network benefits that would make it more affordable for you to see me, and we are happy to help you verify those benefits and submit the claims for you. After that initial phone call, Renee and I will verify your insurance benefits for you and confirm that I'm indeed an in-network provider with your insurance, as well as let you know how much of the contracted fee you'll owe at the time of your appointment. The office is located at 2800 North Parham Road in the Robbins Insurance Agency building near Tucker High School. The parking lot for the building is actually on Mayland in the rear of the building. In case you're curious, you can see pictures of my office on my website. The office is on the first floor and is ADA accessible. Thank you so much for listening, and I hope this video helps you make a decision about whether or not I might be the right provider for you, and I hope to hear from you soon.